I'm now going to introduce somebody that none of you know very well, the CMA President, who this year is one of our own, Dr. John Haggie. And John, with your permission, I will shorten your biography just a little bit because we do know you quite well. John was born in Manchester, England. He graduated from the Victoria University of Manchester School of Medicine in 1977. I wasn't born then. That's a lie. He completed his graduate studies in general surgery and was certified by the Royal College of Surgeons of England in 1981. John came to our province in 1993 as a consulting surgeon for the Grenfell Regional Health Services in St. Anthony. In 1997, he moved to Appleton, where he was appointed attending surgeon, general and vascular surgery at the James Peyton Memorial Hospital in Gander. He's held numerous senior staff positions with the hospital. John has been active in medical politics for many years, sharing his expertise and time with the CMA and the NLMA. He was elected president of the NLMA in 2002, leading the association during its first ever job action. He continued his involvement with the NLMA and CMA, serving on numerous committees and on the CMA board. Now, John has advised me his talk is going to be a little bit less than 2 hours. So I want you to feel free to throw fruit and boo when it gets too long. John, all yours.
Thank you, Lydia. I'm still tidying up your mess and the speeches on the podium after all these years. The first slide, please. Thanks for the introduction. Look, I have this speech, and this is where Owen will probably have some kind of seizure because I'm going to go off script. That's right. Yeah. It's not very often you get a Newfoundlander standing up as CMA President. In actual fact, on the current regime, it'll be every 19 years. So maybe the medical students over there may be even thinking of lining themselves up for the next one. But it was interesting because today we talked about governance at the meeting, and you know, governance is a bit like sticking your fingers in a light socket and turning the switch on repeatedly. It's not something that appeals to most people. But the key about governance is that it gets you an engaged membership, it gets you a nimble leadership. And the reason that's important is one of those things that was hidden away on that slide that Rob talked about, which was professional autonomy. We are a self-regulating profession, and that is not a right. It's kind of one of those things that we've kept to ourselves because in a way we've earned it, and it's been a trade-off. But if you look a little bit further west and talk about physician autonomy, you'll see what's happened in the OMA. And that's where all this comes together. That's where the rubber meets the road, or whatever analogy you'd like to use. The bottom line is, I was in Ontario a couple of weeks ago at their AGM. And as someone who, as Lydia had said, been in the trenches, as it were, in 2002, it was one of those deja vu all over again moments. But what I told them on that occasion at their meeting was that we did what we did in 2002 because we had a system that was badly broken. And the people who were paying the price wasn't the physicians as much as the patients. It was broke. But 3 years after that job action, what did we get? We had 9% more physicians in the province than we had at the beginning. The turnover dropped, and we were actually attracting and retaining physicians. And much to Rob and I's surprise, we actually had almost a working relationship with the government at the end of it. It wasn't that bad. But we weren't the real winners. The real winners were our patients. And so I told them that, and I said that the physicians of Canada were standing next to them when they had to deal with a brickbat being thrown at them. And that included the physicians here as well. And you know, they really, really appreciated that. So I think that's just a little bit of context for what you guys are doing locally about governance. It may not sound very glamorous, but it's really, really, really quite important. So this is where those of you who want to drink heavily might want to get a glass of wine, because I'm going to give you a quick recap about what I've been doing over the last year. And apart from traveling the continent in every direction at least 3 times, this is what we've been up to. We've had this healthcare transformation initiative, and it's been going on really since 2008. It started in General Council. We'd gone abroad to see looked at what worked and what didn't. We did a few things. We developed a charter. We did a lot of consultation, and it wasn't just with the PTMAs, with the Provincial and Territorial Medical Associations, folks like yourself. We took it out and we talked to Canadians. And we had some town hall meetings, and Jeff Turnbull did some, and I came to St John's here and spoke to some medical students and physicians about what the system should look like to work properly. And what was the answer? Well, the answer from everybody was that Canadians in general want a publicly funded, a strong publicly funded healthcare system. But they realise that Medicare version 1 isn't right. They want Medicare version 2. They want 2.0. They said the system was good at providing acute care, but it really sucked when it came to things like chronic care and home care and the elderly. There was this huge awareness, even among the public, about the idea of what was called healthy public policy, and the realisation that healthcare itself is only one predictor of good health, and that other things like housing, economic situation, education and employment really mattered. We also heard very clearly that the feds had a role, despite what the federal government might actually think, in actually facilitating some national standards, some benchmarks, so there was access of comparable nature, comparable quality, whether you lived in Gander or in Natawashish or in Vancouver or Prince George. Bearing in mind the geographical limitations of this country, which in actual fact is huge. You can fly from here to Vancouver. If you turned east, you'd actually end up somewhere in the middle of Russia. It's actually a huge distance for the same amount of travel. You don't realise it until you actually do it. We are the second biggest contiguous landmass in the world after Russia. It's huge. I know. Been there. Got the T-shirt. The other thing that Canadians told us were the principles of the Canada Health Act, Medicare 1.0, the 5 principles weren't enough and they needed to be expanded. So we came up with a document in conjunction with Canada's nurses on principles to guide healthcare transformation. We organised it around the IHI Triple Aim framework, which talks about better care for patients, better population health, and better value for the healthcare dollar. So these principles are there. They help define what healthcare should look like. Is it patient-centred? Is it quality? Is it accountable? Is it sustainable? Which is the big word for the governments. They're worried about the sustainability thing. So when we developed these, we actually took them out. And 120 other groups have signed on to these principles. The divisions, the NLMA, were among the first 12. We've also had not just the usual suspects, as they say. We've not just had healthcare providers. We've had patient groups and advocacy groups actually sign on as well. So it's not just the physicians or even the nurses and healthcare providers. It's a broad-based coalition of people who actually have an interest in health. So where does that leave us now? Well, I mean, we've got these principles and they're great, but how do you actually operationalize them? Where do you take this 60,000 foot view and bring it down into the weeds? What we started to do as a first idea is the idea of indicators, because really you can't improve what you don't measure. Now the OECD has got some on the social determinants of health and common definitions. StatsCan has got some. CIHI has got some. You can argue about them. But if you look at our 6 principles, there's no off-the-shelf system that we can come up with. So we've gone back to first principles and we started to devise our own, and we've had some workshops about that. So the bottom line is that's another consultative process, and the NLMA, along with all the other divisions, will be involved in that. Tony over the coming year. Beyond the funding, though, beyond this whole idea of the feds and the funding, where the actual federal government stand on healthcare is really an uncertainty. And that is actually one of the problems that the provincial governments have. So in January of this year, they have their Premier's Club, the Council of the Federation. I'm not allowed to call them a mafia. The CMA advocacy people will get really upset when I call them a mafia, but there are a small group that you don't get into unless you're a Premier. So what we did was we took our principals, us and the nurses, and we camped out outside their door for 3 days in Victoria. And in the end, and I don't know whether it was because we were there or not, but they struck a working group called the Healthcare Innovation Working Group. And because of our presence, just to get rid of us, I suspect, they said, we'd like you and the CNA as healthcare providers to get involved. And that's a first. That's never, ever happened before. Ever. Now, the group's mandate was to drive a collaborative process for transformation and innovation in healthcare. And the CMA has made sure that we've done at least 110% of the workload of that group. Where does it go? Good question. It's an untried process, it's untested, and the jury's still out. But the thing about it is that maybe optimistic is the premiers, that kind of leadership group, they've stepped up at a national level where there's this huge void, and they've shown a commitment. So, wait and see. July is the answer. And I'm kind of cautiously optimistic. It's a proof of concept, so really what comes out of it isn't as important as the fact that they do come out of it with something. But for us, at CMA, the idea is to take the tools and the information and the expertise we've already got and make it do something. And you know, everybody looks around and says, well, you know, what really has happened? What's changed? What have you done since 2008? We've still got wait times, we've still got problems. But you know, the problem we've got in healthcare is we're physicians, we write a prescription and we expect someone to fill it instantly. And when we don't, we get ticked off. But that isn't the nature of healthcare. It is not a dragon slaying exercise. There's no bad guy to go out and kill and then go out for a drink afterwards. It's not like that. This is an endurance event. It's not a sprint. What we've done is we've changed the language. If you look at what the governments are saying, both at a provincial level and the federal level, they're using the words we got in our documents in 2008. They're talking about accountability. They're talking about patient-centered. They're talking about a focus on the providers providing for the patients. They've talked about patient charters. There's several jurisdictions now where those exist where they didn't before. It may not work for everybody, but it's a tool in the box. Those things weren't there before. They're there now. In the last federal election, nobody wanted to talk about healthcare until CMA got up at the federal election and got it on the agenda. And it hasn't gone away. And it will come back again in 2015. And if there's still a problem after that, it'll come back again each time. It won't die. And that's where we've made a difference. And people find it hard to realize. But that is actually down to you guys at the NLMA and the divisions and the CMA working together. And it is kind of a nation-defining challenge. Canadians have told us that it needs to be fixed. But apart from healthcare, there are issues outside of medicine that actually dictate the health of our patients and our population. And I went round the north last year, over the course of this year, and I started in Labrador because I'd been there before, I'd worked there. And it was an old haunt for me in some respects. So I went back to some of the folk I'd worked with to look at and see if things had changed. There's been some great advances in healthcare. You know, Rosie the robot and this kind of stuff that Michael's done in Goose Bay. They're world leaders. You'll not find it anywhere else. But it's still so discouraging to see that many of the social and economic inequities that plagued our province and our country then are still there now. It's like the $7 a head lettuce syndrome. You go out on the north coast, you tell people to eat healthy, and what's their choice? They've got one limp lettuce head at $7 a pop, and it's $8 a pop for a quart of milk. And it's symbolic of a lot of the issues that Canadians face and us as their advocates have to deal with. So last year, here in St. John's, just up the road, General Counsel said, do something about it. Develop some policy papers on the role of physicians, what doctors can do around what we've called health equity. It's really just a relabel for the social determinants of health. And we've delivered. In Yellowknife in August, that paper will be there. Michael Marmot, who some of you know, who's a world leader, he did the WHO report on social determinants. He's done one in the UK, he's done one in Europe for WHO. He's our guest speaker. He's going to do an education session, he's going to do a strategic session. And I hope that the delegates from here will actually go and speak up in the same way that some of those motions that came forward this afternoon speak to the issues that we need to deal with. So as healthcare transformation moves forward, we've got lots of people actually who are willing to partner with the physicians, with us, to help transform this publicly funded system so it actually meets the needs that Canadians have. It doesn't matter where you live, it doesn't matter what you earn. But the key is partnership, because no one group can actually do this alone. It's an endurance test. It's turning the battleship, or the Beaumont Hamel, at full speed and hoping it doesn't hit the dock. It's got to be a system that performs, it's got to be one that's accountable, and it's got to be efficient. And if we don't change it, we're not going to have one. It won't be there for our kids. But as physicians, it's our responsibility. We're the leaders within the profession, in this room, and within our communities, to advocate on behalf of patients and to lead that call for change. So, what I'm doing here is just simply pointing out for you that the time is actually now to do this. And what I want from you guys is that you'll join in and help us make it happen, because I can't do this by myself. Nobody else can. So the Rick Mercer rant is now over, and hopefully it wasn't the 2 hours that Lydia projected. So thank you very much for your time and indulgence. Thank you.
We're going to move into the presentation of awards. And I need my glasses.
Madam, may I be of assistance?
We have some scholarship winners. Each year, the Physicians' Legacy Foundation of Newfoundland and Labrador, the NLMA's charity, provides scholarships and financial assistance to medical students attending Memorial University. I'd like now to recognize our most recent recipients. The NLMA Award, I'm pleased to announce that David Harnett and Bolu Ogunyami are the recipients of the NLMA Award, valued at $1,000. David and Bolu were selected by the Dean of Medicine's Committee on Awards, Bursaries and Scholarships. The award recognizes potential interest in the organizational aspects of the medical profession as judged by contributions to the governance of Memorial University of Newfoundland's Faculty of Medicine. The winners received their awards during Memorial University's Scholarship and Awards Luncheon for medical students this past fall. So we'll congratulate them. The Phyllis H. Madryga Scholarship. The 2012 Dr. Phyllis H. Madryga Scholarship has been awarded to Laura Edwards. This award is valued at $3,000. Laura was selected for this award by the Dean's Advisory Committee on Awards, Bursaries, Scholarships, and the Foundation. Dr. Madryga, whose scholarship is named for, provided many years of dedicated service to the people of rural Newfoundland and Labrador, I think in the Trinity area. While she is currently enjoying retirement, she remains a strong supporter of medical graduates from Memorial University who choose to stay in this province. The scholarship is awarded annually to a student from rural Newfoundland and Labrador in their final year of med school, with plans to practice rural medicine. Academic achievement, strong personal values, and leadership within the Faculty of Medicine are also considered. Laura will receive her award tonight at the med school's graduation dinner and dance, which is going on at the same time as our awards. So congratulations to Laura. Next is the NLMA Bursary Program. The Physicians' Legacy Foundation has awarded 10 students a 2012 NLMA bursary. These bursaries are valued at $1,880 each for 2012. The Foundation awards bursaries annually to medical students in Newfoundland and Labrador, funded seats at Memorial Newfoundland's Faculty of Medicine. The bursaries are sponsored by the Canadian Medical Foundation, a charitable organization dedicated to the support of medical education in Canada, and in part through the generosity of MD Physician Services, TD Insurance Meloche Monarchs, NLMA member donations, and through the NLMA corporate donations in memory of passing members. And I don't believe, Lynn, we do have names of those recipients? No. Yeah, I don't have names. Okay, all right. So congratulations to those students. The final student award is the Gerry Lynch Memorial Scholarship. The 2012 Gerry Lynch Memorial Scholarship has been awarded to Paul Boland, and this scholarship is valued at $3,000. The Gerry Lynch Memorial Scholarship is awarded annually to a medical student at Memorial for the completion of a research paper on a medical political topic. This year's topic was self-regulation, the challenge of maintaining public trust in an environment of increased scrutiny and criticism. Paul's winning essay is available for all to read on the NLMA website. Gerry Lynch, for those of you who don't know, served as Executive Director of the NLMA for 27 years, and he was unfortunately killed in a car accident. The scholarship reflects the contributions Mr. Lynch made to healthcare policy, both provincially and nationally. The scholarship is provided by the Canadian Medical Foundation, a charitable organisation dedicated to achieving excellence in healthcare through medical philanthropy. Paul is also receiving his award at the med school graduation dinner and dance being held this evening. So congratulations to him. I would now like to call on Dr. Ford Bursey, representing the Royal College of Physicians and Surgeons of Canada, to present the Mentor of the Year Award to Dr. Elias Bartellas.
Thanks, Lydia. It's my absolute pleasure to, on behalf of the Royal College of Physicians and Surgeons of Canada, to award Dr. Elias Bartellas the Mentorship Award for RAC 5. Now, for those of you who don't know about the Royal College kind of structure, it's broken up into 5 divisions, not 12. And the RAC 5 are the 4 Atlantic provinces. And so on an annual basis, the Royal College puts out a call for Mentor of the Year for each of the 5 regions, and there is a regional selection committee. And this past year, 2011, the regional selection committee chose Elias as the Mentor of the Year. And before I get around to kind of quoting some of the things that were in his recommendation letters, I would put out a plea. Elias's award is for the year 2011. Some of you who are members of the Royal College may have received in the last few weeks an urgent email from the Royal College. They've extended the deadline for nominations because even though it's a very valuable award and it gives great recognition to what we think of our peers, they've had to extend the deadline this year, because there were no applicants. So I think as part of this, no submissions. So as part of this, people that need to get recognized are not just the Mentor of the Year, but the people who take the time out to say, my colleague is worth recognizing. And I think that perhaps isn't as recognized as it should be. And so I will read a little bit from the letters of recommendation of the sponsors of Elias. I won't tell you who said exactly what, but the 3 nominees for this award were Terry O'Grady, Heidi Kravitz, and a PGY2 resident at the time, Stephanie Cody. And I don't know if she's in the audience tonight or not. I don't actually know Stephanie, but I know Heidi and Terry, as I'm sure most of you in the room do, very well. And they made such comments like, Dr. Bartellas has always been quick to offer encouragement to a learner. He would be sure to notice if something were amiss and offer help or support. If a student showed an interest in our specialty, he made great efforts to encourage that interest. I am eternally grateful for Dr. Bartellas, who has both inspired and taught me skills that doctors rarely have the opportunity to teach their residents. His quick decisions, steady hands, and calmness during what seemed to be a period of sheer panic was inspiring. I knew in that moment that through his years of experience, I could learn immensely from him. Although it appeared to be sheer panic surrounding us, the confident and reassuring Dr. Bartellas took time to teach me. Dr. Bartellas continues to be a great role model for his colleagues and his students, and he fosters interest in continuing medical education. He is an advocate for medical residents who may be having difficulties, and over the years has also helped many medical residents with their research. I can't think of a more deserving practitioner and educator for this prestigious award. Another note, since I have been teaching myself, I have always tried to emulate his patience and good nature. He taught me to see things from the learner's point of view. Because of his example, I have learned to adopt my teaching to the student's style of learning rather than expect all students to learn the same way. Now, those of you who know me know that I'm a gastroenterologist, so I stay as far away from the obstetrical and gynecologic world as possible. But I'm old enough, and there are two of my classmates in this room today, Dr. Lydia Hatcher and Dr. Fred Jardine, and we all went through the old rotating internship, and we were all students of this guy. He was a brand new consultant when we came through. So he started work, I think, in 1981 here in the city. And Fred, Lydia, and I are graduates of the class of '82. So he had a hand in pushing some of us away from obstetrics and gynecology, but certainly, but certainly is well respected by some of the comments that I've read here by both his current colleagues and by some of his students. Before we actually present the award, his daughter, Amelia, would like to come up and have a few words to say as well.
Hello, everyone. As many of you who know my father, this is definitely a very big occasion because he's wearing a tie and black shoes. So make sure to take a good look because you'll see the sneakers again. Unfortunately, my mom and brother and sister couldn't be here tonight. They're out of the province. And so my mom wrote a lovely letter that I had to read. I'm very proud to read. Elias, we are so proud of you today on receiving this award. You have, and I can vouch for this, put in hours at work to become the specialist that you are. You have always understood the importance of continuing to learn and evolve as a physician. Over the years, I would say you brought many new techniques to obstetric service in St. John's, including colposcopy, laparoscopic surgery, and microsurgery. Academically, you are always at the top of your game. I think, however, that this award is given to those who show great humanity. Elias has never refused to help a colleague in distress and is a great team player. The same approach is seen in his service to his patients, and they have shown their gratitude with countless bottles of wine, chocolates, crab, mousse, you name it. There are also a few babies in St. John's who have been called Elias after him. It's a high honor. He has also gone the extra mile to be there for the residents. This has not always been easy and has involved a great time commitment and a dedication to their education and career advancement. I guess in their way, they have noticed all of this, and that's why you're being recognized tonight. Despite all of the above, you're one of the most humble people that I know. Congratulations again on a well-deserved honor. Enjoy the day, and sorry we couldn't be there. You're a very loving and proud wife, Maeve, son Michael, and daughters Katrina and Amelia. Thank you.
So I had to wait for such an opportunity to hear what my wife thinks of me after so many years.
Okay. There are a whole bunch of other comments that were in his letters of recommendation that I could read, but I'm sure from the few that I read and from the ones that you've heard from his daughter that there is no doubt that Elias is very deserving of this. He has demonstrated over his career that he truly is a mentor, a colleague, interested in education, interested in just supporting people as individuals. And so I would like to ask you to join in me as we present this recognition from the Royal College to Elias Bartellas.
I don't have a speech. I'm not good in speeches, but I'm really humbled and honored by this recognition by my peers. I see a lot of faces here that I remember when they went through medicine, and I hear since then I hear how they are doing all over the province, and I'm so proud of them. And I feel that every one of us here continues to do what other teachers did to us. You know, I was a mentor for you, most of you that you know me, and I hear that you are doing the same thing. So we do it because we love what we do, and we inspire all the medical students to love what they do, continue what they do, and teach them to be mentors for the rest of the students. I thank you.
Well, on a personal note, my first pregnancy, I ended up with PIH, and my gynecologist ended up being Dr. Bartellas. And when I had to have a section, the surgical assist was none other than Ford Bursey. In spite of his dislike of obstetrics, my daughter is now doing internal medicine at Queen's and is herself pregnant. Thank you, Dr. Bursey, and congratulations to Dr. Bartellas. I would now call on the Honorary Treasurer, Dr. Bridget Fernandez, to present the NLMA Honorary Life Membership Award to Dr. Ronald Whelan.
Thanks very much, Lydia. It's my pleasure this evening to introduce this year's recipient of the 2012 NLMA Honorary Life Membership Award. The award is presented each year to a physician who has distinguished themselves by their achievements in medicine and in service to the association. Tonight, we're honoring Dr. Ron Whelan for his outstanding accomplishments and service to the medical profession in Newfoundland and Labrador. After graduating from St. Bonaventure College in St. John's in 1950, Dr. Whelan apprenticed as a pharmacist in St. John's and later in 1954 worked as a pharmacist in Stephenville. Returning to St. John's in 1957, he operated his own pharmacy for the next 3 years until he decided to pursue a career in medicine. He enrolled in pre-medical school classes at St. Dunstan's College in Charlottetown, Prince Edward Island, and later transferred to Dalhousie University in Halifax. He earned his medical degree in 1967 and spent the next year working as a general practitioner in Gander. In 1968, he returned to Dalhousie to begin a specialty program in radiology and in nuclear medicine. Upon graduation in 1973, Dr. Whelan returned to St. John's and began a lifelong career of employment and service to St. Clair's Mercy Hospital as a diagnostic radiologist until his retirement in 2009. There, he was a strong leader and advocate for patient care and for the acquisition of diagnostic equipment to better serve the public. During his career, he held such positions as Chief of Diagnostic Imaging at St. Clair's and Chair of the Medical Advisory Committee for the St. John's Healthcare Corporation. His expertise and counsel has been sought many times by the Government of Newfoundland and Labrador to examine the province's healthcare system. In 1988, he chaired an investigative committee on the quality of medical services to inmates at Her Majesty's Penitentiary. Later in 1996, he chaired an investigative committee to the Peninsula's Healthcare Corporation. He also volunteered as a fleet doctor for the seal hunt in 1982 with Captain Morrissey Johnson. From 1987 to 1993, Dr. Whelan taught as a clinical associate professor of radiology at Memorial University. He became a well-respected and inspirational leader in the medical community, lobbying for more medical specialist mentoring and for promoting young local graduates of Memorial to fulfill the specialist void. His enthusiasm in promoting medical education also made him a leader within the Newfoundland and Labrador Medical Association and the CMA. Dr. Whelan firmly believed that service to the profession was just as important as service to the patients. He served as secretary on the NLMA's executive from 1974 to 1976. He rejoined the board in 1978, and in 1979 he was elected the president of the NLMA. He joined the board of the CMA a year later and became a member of the CMA's executive committee in 1983. In 1984, he served as the chair of the CMA board, and in 1988, he was appointed as the deputy speaker of the CMA's general council. He joined the CMA board again in 1990, and in 1992, he was elected the president of the CMA. Dr. Whelan also served as a member of the Newfoundland Medical Board, now the College of Physicians and Surgeons, and served as its chair from 1983 to 1987. His leadership in promoting medical education in the province was recognized when, in 2001, the federal government appointed him to the board of directors of the Canadian Foundation for Innovation. In that role, he has been involved in the decision-making process behind significant investments of federal funds into innovative research and development at Canadian universities over the past decade. In 2000, the Royal College of Physicians and Surgeons of Canada recognized Dr. Whelan as Regional Specialist of the Year for his contribution as a medical educator and his service to the community. That year, he was also honored with the CMA's Honorary Lifetime Membership Award. In 2009, Dr. Whelan received the Canadian Council Foundation Award in appreciation for his expertise and dedication to the foundation. On a personal level, Dr. Whelan has an abiding interest in Newfoundland history, and he's been involved in a number of heritage organizations, such as the Railway Coastal Museum in St. John's, the Holyrood History Club, and the Elliston Heritage Foundation Advisor Committee on the Sealers Memorial Statute and Interpretation Center, which is due to open in 2014. He also has a passion for exploration and travel, particularly sailing. He has used his photography and unique storytelling ability to educate the public through lectures about his sailing trips around the coasts of Newfoundland and Labrador, his trips to the seal hunt, and his expeditions to the Arctic and Antarctic. He resides in St. John's with his wife, Betty Lou, a former head nurse at the Victoria General Hospital in Halifax. They have 2 children, Elizabeth and Paul, and 2 grandsons, Peter and William. Ladies and gentlemen, it gives me great pleasure to welcome Dr. Ron Whelan to the podium to receive the NLMA's Honorary Life Membership Award. Congratulations, Dr. Whelan.
Thank you so much for this honor. I've stood in this place and I have honored many seniors of our profession who at the end of their day gets this award which they treasure, and for the kind words that were spoken about me. And thank you very much. I'm sorry, it's Madam President. Thank you very much, Madam President, and all the members of the board. Thank you.
Well, I kind of feel it's just fitting that I should tell my couple of little stories about how I know Ron. I was a medical student and I did an elective in radiology. And what I remember best about Ron is he got a really new piece of equipment and he was gardening and he'd had a little accident with the equipment. Do you remember the whippersnipper? Snipped your whole leg. And of course, how could I forget all of our CMA meetings where Ron would lead us in the singing at the CMA meetings at the Newfoundland night. I would now like to call on Dr. John Haggie again, as CMA President, and Mr. Owen Adams, Vice President of Health Policy and Research with CMA, to present the CMA Honorary Life Membership Award to Dr. Ernest Trude Dureke and Dr. Russell Oliver Harpur.
There's no escape. CMA Life Membership is an honour that is bestowed upon a physician who, at the age of 65, having been a member of the CMA, an active member for at least 10 years, is recommended by his colleagues within the division, and that recommendation is unanimously accepted by the board of the Canadian Medical Association. These are physicians who encompass and embody the motto of the CMA, Integritate et Misericordiae, integrity and compassion, and are regarded by their peers as physicians of outstanding caliber. And so I'd like to call now upon Mr. Adams that he can read out the citations for these individuals so that I can present the award.
Thank you, Dr. Haggie. Dr. Ernest Dureke cannot be with us tonight, and Dr. Lewis will be presenting him with his pin and certificate at home, but I'll read the citation. So although Ernest Dureke practiced medicine in Newfoundland for much of his career, he spent 4 formative years in the Nigerian Armed Forces as a squadron leader and full-time anesthetist. During his military service, he had much success with blind intubation on patients who, due to trauma or disease, were unable to open their mouths. In 1984, he moved to Western Memorial Hospital, Corner Brook, as staff anesthetist. After retiring in 2002, he provided locum service for several years. So that's okay. Call the next one then. Okay, so could I call Dr. Russell Harpur up, please? Up there. Okay, all right. Great to see you. Thanks. Okay, so Dr. Harpur, when he retired in 2006, Russell Harpur had enjoyed a rewarding medical practice at Memorial University of Newfoundland, where he was Director and Senior Physician of Student Health Services and Clinical Associate Professor of Family Medicine. Highlights of his career include academic teaching, community outreach, introducing a peer health education program at Memorial, and the design of new medical clinics for the University Centre and the rural community of Lewisport, where he first practiced. So, Dr. Haggie, may I present to you Dr. Russell Harpur.
Well done, sir. Well done. And you got this rather nice pin, which is actually nicer than mine. Well done, thank you. Do you want to say a few words?
My wife and I came to Newfoundland over 42 years ago, and we've been here ever since and loved every moment of it. We followed God's leading in our lives to come here. When I was 15 years old, there was a turning point in my life. At that time, I understood the gospel and that Christ came into the world to save sinners, of whom I was a chief one. And I prayed sincerely that God would show me His will for my life. And although no one in either side of my family had ever been to university, I believe the Lord had for me to become a physician, so I set about getting the marks that I needed to get into medical school. I remember well, there were 567 applicants for 84 places. I was one of the 3 youngest in my class. When we came to Newfoundland, leaving the troubles behind in Northern Ireland, it was a wonderful experience to work in rural Newfoundland in Lewisport, and that was in the days of dirt tracks, no paved roads then. I did home calls 40 miles one way to visit seniors and others in their homes in places like Horwood and Stoneville. And then I was very fortunate to be appointed to Memorial University. And I believe I had one of the most interesting jobs as a general practice family physician in the province, because as being responsible for international students from more than 80 different countries attending Memorial University, that gave me a tremendous interest and a special privilege of treating those international students and their families. So every moment of my career in medicine, 7.5 years in Lewisport and 29 years at Memorial, have been a real joy and a real privilege, and one for which I am very, very grateful to all of those who were involved. Some of the physicians who worked with me while they were establishing their practices in St. John's are here this evening, and it's just been a wonderful experience. Newfoundland is a great place to live and a great place to bring up a family, and I heard of someone tonight who boasted of having 2 grandchildren. My wife and I can now boast having 9 grandchildren. Thank you very much.
Mr. Chairman, Madam Chairman, the script is wrong, you see. Owen, I should have strayed from the script. Honoured guests, ladies and gentlemen, it's my pleasure as President of the Canadian Medical Association to install your new President in office. So I need you and you, Tony, up here to join me on the podium. So you might want to go that way. I think there's a bit more room over there. You go and hover in the background. Okay. Upon the invitation of this association and by virtue of the authority vested in me, it is my great privilege and pleasure, and this doesn't happen very often, to install a new president of the NLMA. So, Madam President, on behalf of the association and its members, I'd like to express to you and through you to the other members of your association heartiest congratulations on the achievements under your tenure. Well done, Madam President.
Feel a lot lighter.
Dr. Gabriel, Tony, come over here. It is my great pleasure to put this, which is actually a lot heavier than it looks, to install you as President of the Newfoundland and Labrador Medical Association. There you go. During your term of office, you are charged to keep and preserve well and faithfully the statutes, customs, rights and privileges of the association and to promote its well-being insofar as you lies. Tony Gabriel, you're it. It's also you also get a pin to wear on those occasions where the necklace might be a little bit too heavy. It's also deemed appropriate for you to wear that, and not just now, but on many other occasions as well. So you have your first duty to perform, sir. It's all yours.
I've been told my first duty is to give Sandra a special thank you and a gift. But I'm looking for the gift.
I thought it was safe to say.
Ah, okay. I almost fell down on the job right off. Well, that's pretty good. So I was going to save this till later in my speech, but I guess I get to do it now. And I guess it is with heartfelt gratitude, thanks, and that I would like to welcome Sandra back to the stage, and she's on her way, to thank her very much for a great year as president and a great leader and a great role model for all of us as to how well you handled at times a very difficult job, and I can only hope to even partially follow in your footsteps. So Sandra, on behalf of the NLMA and all your colleagues and all the staff of the NLMA, thank you very much for your year in office, and this is a token.
Congratulations.
Now I'm not sure if I don't have a script. Okay, I'm supposed to have a speech now. This is a script that I don't have. This is my concern. So I have a speech though. So, but before I get to the speech, I must say that after seeing all the individuals honored up here tonight, I feel that it's one of those times where you can't say leave the best to last, because I certainly don't think that that was the case here, because there's some tremendous individuals that were honored here tonight. So I would like to just to once again recognize all these individuals that were honored up here tonight. And I realize that I don't have my speech here. I grabbed somebody else's. That's good. Okay, first, that's perfect. Well, talk about getting off to a really good start. So, good evening, ladies and gentlemen. And I'd like to extend a special thank you to my family for coming out tonight. I really appreciate you being here. It's great to have you here. It's a pleasure to have everyone here tonight to honor all the people that we have. And I'd like to extend, again, a special congratulations to Dr. Bartellas, who was a mentor of myself as I went through. And I must say, your humbleness and your humanity is something I took away from your time teaching me, I must say. And I hope I learned a little bit of what you had to teach us in the time I was with you. It's a pleasure to be here tonight. As I look forward to my year ahead as President of the NLMA, I'm honored with the confidence and trust that's been placed in me. During the past year as President-elect, I've gained some increased understanding of the important issues affecting physicians and the patients of our province. What has become increasingly evident is that change is upon us. We're moving forward with our governance review that will help shape the strategic direction of the NLMA for the coming years. In the next year, we will first begin the search for a new executive director for when Rob retires. And although it's hard to believe, we will be getting ready to negotiate a new MOA with government. The current one expires in October of 2013. And as of next April, we can start in with a vengeance once again. Since negotiating our last one in 2010, physicians have achieved a lot of milestones. We now have binding arbitration. We have pretty much Atlantic parity, which has always been a really focal point of our association, so that we can be on a level playing field with the physicians of our area of the country. We have a form of retention bonus for most rural physicians, and we've corrected a lot of the disparities that had existed amongst the salaried specialist incomes in the province. We've had great challenges over the last few years, but we've risen to the occasion thanks to the hard work of the NLMA and especially its members. As we proceed to plan for our next round of negotiations, we will continue to advocate for measures that will ensure we remain competitive in order to sustain an appropriate physician supply in this province. But we must also be realistic in our expectations. This next round of negotiations is going to be very different. The way we finance healthcare in Canada is about to change profoundly over the next few years. Everyone in this room has read or heard in news coverage over the last few weeks and months about governments trying to tighten their budgets by reining in healthcare costs, especially in the area of physician fees and payment models. When we look at the most recent examples of physician negotiations from other provinces, we begin to see evidence of a new normal taking shape. Physicians in Nova Scotia have agreed to add 2 years to their present 5-year agreement, and it will see them defer their original annual increases of 4% and instead accept 1% increases over the first 2 years. The New Brunswick Medical Society has agreed to accept 2 years of no increases whatsoever immediately following the expiration of their current agreement. The Government of Ontario is famous now for pushing for 0% increases in the first year of its new physician services agreement, but more so because it's announced a package of cuts to doctors' fees that will unilaterally be imposed through regulations with no negotiation at all with the OMA. Ontario's Premier Dalton McGuinty wrote to all premiers of Canada urging them to follow his lead. The Globe and Mail recently had an article that suggested that Ontario may be setting the pace for a nationwide shift to rein in doctors' fees and salaries, and British Columbia is already on the books as apparently looking at taking similar actions. A lot of this probably dates back to last fall when Federal Finance Minister Jim Flaherty announced new funding arrangements for the Health Accord, which is going to expire in 2014. These arrangements will remain in effect until 2024, and basically this was put on the table without any negotiation with the provinces. Ottawa, in this proposal, has guaranteed healthcare funding increases of 6% until 2016, but after that, any increases are going to be tied to each province's nominal GDP. The effects of these financial changes and restraint and what it will have on the quality of healthcare in this province remains to be seen. But the impact is going to become more evident as the effects of our aging population and the increasing demands for healthcare unfolds. Here at home, Finance Minister Tom Marshall delivered his budget in April. It included an announcement of a new review that was going to be aimed at carving out unnecessary spending in the future. The ultimate goal of this review is to restrain the growth in program spending to reduce the province's debt. In this last week, we've seen Eastern Health unfurl its own measures to try and contain its spending, with the equivalent of 500 full-time positions being eliminated over the coming months and years. And the full effects of this we will be aware of over time. These are the new realities that we face in this area of transformation. The most important question for us is, are we going to be the objects of change or the agents of change? A sustainable system must control both costs and provide appropriate health care. As government struggles to contain costs, we need to be part of the solution. We have to be the agents of change. As Sandra mentioned earlier today, what will be critical as we proceed to fully implement our MOA and begin preparations for a new round of negotiations is cultivating a collegial relationship with government, one that is based on mutual respect, consultation, and cooperation. Sometimes, as we're all aware, conflict between physicians and government is inevitable. However, we both share core values, and we both have concerns about the future of healthcare in this province, and this can serve as a foundation for collaboration. A strong and effective relationship benefits everybody, government, doctors, and most importantly, the people of the province. Over the coming year, we will be working hard to fully implement all of the outstanding projects under the MOA. We will see the full benefit of our microallocations exercise and the current reviews ongoing for the MCP preamble, the Category B emergency services, the alternate payment plans, and the on-call program. We will also continue our work to advance a number of physician-led initiatives that will have a positive impact on the province's health system, including streamlining the medical referral and consultation process, strengthening the physician health program, developing a collaborative mental health strategy aimed at improving wait times, research to reduce seniors' length of stay days in acute care facilities, and a number of physician leadership initiatives designed to promote excellence in medicine. I would like to talk to you now about a shift in public perception towards physicians. Last December, the CMA had Ipsos Reid conduct a survey on physicians. The findings suggest that nurses and other healthcare professionals are seen as collectives. However, for the most part, doctors are seen as individuals. And as individuals, our reputation is very positive. But when physicians are referenced collectively, comments from the respondents were more negative in tone, and the provincial medical associations were predominantly seen as being motivated by self-interest. When compared to national trends, however, physicians in Newfoundland and Labrador enjoy a very positive reputation. However, we ourselves have seen a slight decrease in our own reputation polling in recent years. The distinguishing features that separates the NLMA from other organizations must be a commitment to strive for what is best for our patients rather than self-interest. The trust and respect our patients have for us individually was a significant factor in the successful conclusion of our difficult negotiations in 2010. The public's respect and our reputation is of the utmost importance as we move forward, but our respect and our reputation must be earned. The NLMA must be and must be seen to be advocating on behalf of all patients for quality health care, just as we as individual physicians are doing in our daily practices. The NLMA governance review is now moving forward. This review will identify our challenges as an organization and help shape our direction as we move forward. There will be significant changes as to how the association is run and engages with our members. Our goal is to build a more vibrant association that attracts increased member interest and opportunities for meaningful participation. To improve our understanding of the needs of groups within the province, and membership of the province, we must continue to communicate with each other. Over the coming months, I look forward to meeting with you during my President's tour. These sessions will provide you with a detailed update on the implementation of the MOA and how it's proceeding. It will also be an opportunity to provide the NLMA's team with your input and ideas as we move forward in our governance review. We have many challenges and we have much work ahead of us. With your support, I am confident we can meet these challenges and continue to provide our patients with the quality medical care they need and deserve. In closing, I'd like to say a special thank you to Sandra, who is sitting over there. Your commitment to the physicians of this province is unquestioned. Thank you for your time, your energy, and your devotion once again. Finally, I'd like to thank you all again for the confidence that you've shown in me to make me the president for the next 370-something days, I've calculated. Sandra was a little shorter than that, I pointed out, because her long year is... That's it. With the support of the professional staff of the NLMA, I look forward to fulfilling my duties and hopefully having a very successful year as your president. Thank you very much. Another script bit that I have to give a gift to somebody else. I didn't look at the script apparently, or I didn't see the script. It's okay. Dr. Gabriel makes his remarks. Okay. Oh, Dr. Gabriel makes his remarks and invites Dr. Luscombe to come forward. No, that's so. I've done that. Okay. Oh, I'm the one giving the gift. Okay. Yeah, I see that. Dr. Gabriel invites Dr. Haggie to come forward. I think I need a little more preparation for next year. On protocols.
Good day, sir. Again.
Hi, John.
Hi, Tony.
Apparently, we're going to give you a gift.
Oh, good. That's really good. Yeah.
So, on behalf of the NLMA, this is all for comic relief, if you realize this. This is all scripted. Every single bit of it has been scripted. Thank you very much for attending our meetings and giving us great humor, great information, great service as always, and great appearance at the annual AGM as always. And thank you very much on behalf of the association yet again.
Thank you very much.
Okay.
2 Gander Docs.
That's it?
I got one for you too.
Oh, gee.
He's like a mutual loving.
Why, thank you, John. This is great. Perfect.
I'll take this one. This looks more interesting. That one is for all the papers you're going to have to carry away from the negotiations
Marvelous.
meeting.
Okay, thank you very much.
No, that's mine.
Oh, that's your
That's
notes.
mine.
Okay. Well, should have been my notes. I might
It's all
have.
mine.
No, that's my speech. Oh, no, it's yours.
Sit down, Tony. I know, it's been a long night for you, hasn't it? Now he's got that chain, it's just, the brain is a fog, right? Been there, done that. That's the end of our awards night. Thank you very much all for coming. I would remind the board members that you have a board meeting tomorrow at 9 a.m. at the NLMA House. And have a great rest of your night. Thank you, and good night.